What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the house supervisor slash rapid response at the hospital for the Xray tech protocol. So to give you context, I'm a night shift Xray tech. I've been doing it for over 4 years in the great state of Texas. And essentially, for those who do not know, each hospital, depending on the trauma, 1, 2, mine's 3, there will be, at first I thought it was a doctor, but then I quickly realized that there were nurses when I was like still a student, because I started looking at their badge. But essentially there will be 2 people who are nurses, who usually are the ones who've been doing it a really long time, or who are pretty, like, they advance up the rank to, like, I would say house supervisor nurses are like the top, deal with like all the code strokes, deal with like anyone on the floor, or even in the emergency room. But usually in the emergency room, the doctor and the nurses in there, but they still get involved. Any patient who gets bad to the point where they may have to intubate, they may have to send them to the ICU, like their stats, I'm not sure exactly what qualifies for them to get involved. But all I know, every time they call me, the patients are pretty bad. Either they need a chest tube, they got pneumo, they had maybe post-surgery, they had problems. Usually they're like severe and like really, really bad. They can't breathe, or they're expecting that the patient's not doing good, right? So usually if other floors on the hospital call, certain floors like ICU, surgical ICU, or the emergency room, those are the highest priorities for us as X-ray techs. Because certain floors will call and like their exam, it can be like a morning port for us, and it's not rapid. But if house supervisor or the rapid nurse calls, you gotta go, because whoever's over there is not doing good. Like even our manager told us when he was still, when I was still training, he's like, if they call it, you gotta go, even if you gotta split up, because there's only 2 of us, one of y'all gotta be up there to shoot it. Usually we just shoot a chest X-ray. Sometimes you go up there and shoot a chest X-ray and a KUB because the patient gets intubated or they need to recheck their tube, like their NG tube, OG tube. So that's something that occurs over there. Let's see. Majority of the times they'll look at it and they'll be usually with the nurse practitioners with them. Usually they have like 1 or 2 that will like look at the exam compared to like the prior stuff like that. Depending on what they see, sometimes you'll be in the ICU and an actual doctor looks at it. And depending on what you got going on, if you're already going upstairs and it's after like ours, like 12:30 is when morning port starts at night. If we're already up there, we'll shoot them. We'll just go and continue to do our rounds. Depending on what floor we are, some of them you'll have to come back down and put stuff online because no doctor looked at it, just so it can get a report. Other times, if the doctor already looked at it and they already told you, like, hey, this is good, go on, whatever, then usually we'll be more chill and don't have to race downstairs to put it online. We can like kind of continue to knock out stuff like that. Let's see. I know for a fact that at least in our hospital, the NICU, when the rapids over there at NICU, any stuff with babies, because it's more harder to read, usually they'll want those online. So for sure, we'll just head downstairs and put them online. Let's see, what else? But sometimes I've noticed that I've seen certain floors where they'll call, the house supervisor will call, and we'll get there and he's gone. My brain, whenever that happens, usually the patient's already stable, or he's not doing good and they're off to another patient, because sometimes we'll go back to back to back of house supervisor calls, or we'll be with the patient and they'll be like, hey, we're going to need you in so-and-so, like in so-and-so's room. We're going to shoot one over there. They're giving us a call. Or even for them, if someone codes, usually the house supervisor will show up too. Or any gunshot wounds in the emergency room, they'll show up too. Or I think when any patient's very hostile, sometimes they will also show up too. But those really don't involve us for that one. But I think that's about all I got on those. So for sure, always when it's house supervisor, be on top of your game. They're like the highest level of the nurses, and for sure you can get fired if something, any type of altercation can occur with them, because they have like super high ranking and seniority. So I would just try to, get along with them and try to, I have no problem with them, but like I'm just saying, certain techs have beef, but like I'm just saying, those are certain people that can get you fired. So I would tread lightly and always do your best, All right, we'll see you on the next one.